Hello, good afternoon. Welcome to Nigeria Now on Equa Television, where we keep you updated with some of the happenings in the country, especially looking at various sectors, whether education, health, human angle, and then we'd love you to be part of the program. So do well to drop your comments and your views. They are always welcome. So drop them on Facebook and YouTube because we would love to hear your own views about them. I am Sada Elisha. I'm doing the program with Rachel Tansi. Good afternoon, Rachel.
Afternoon, sir.
All right, let's look at some of the matters, and we will love to start with the health sector. Already, we're seeing that the World Health Organization have actually said the fact that globally there is an emergency regarding mpox, which we know as the monkeypox, and this is really worrisome because we're seeing that presently in Nigeria we're having about 39 new cases. So if we were aware that this is not the first time we're having the issue of the monkeypox, but then I mean, presently that is the number. And I took the liberty to just go back, like, how did we get where we are presently, Rachel, regarding that? And immediately I saw the monkeypox, the first that came to my mind, I recall or remember when we had the issue of the Ebola. Remember the scenario where a lot of people were taking salt. We had people who
Yeah.
were very ignorant. I mean, I
Yeah.
clearly remember then my landlord knocking my door back then. I was in school and telling me, Stella, wake up, wake up, wake up, take salt. And I was wondering, wait, is Ebola having legs? Is it walking
Yeah.
and all of that? But that was the fear, and then we know what it resulted. Of course, some people, as a result of taking the salt because of their health, some people actually died. Other people, their health condition became worse and all of that. Now, going back to the issue of the mpox, which actually is the monkeypox. Now, till date, we're yet to really categorically state what really is more like the cause of it, because we know they said the first time it was discovered was in Denmark about in the 1950s, 1958, I guess, yeah. And then it was found in some monkeys during research. Now, it's not as if it's from monkeys, but because it was found in monkeys, I guess that is how it came about to be named the monkeypox. But we're seeing that the first case we had was in Congo, where we had a 9-month-old child dying, and that was far back then. And since then, this has been an illness or a virus that has been in Africa for quite a
Yes.
number of years. And then presently we're seeing that there is a global emergency where we're also seeing where the NCDC has confirmed the cases, putting certain places on red alert, where we're seeing that the government is moving forward, making sure that our airport, our seaport, and everywhere is being protected, because there is a need to do something. And if you recall, Richard, I said, I think from beginning of this week or so, where we've been having those pockets of report coming left, right, and center, I said, I hope our health sector are ready, because I clearly remember that of the Ebola. The world really applauded us because it didn't take us much time during the Goodluck Jonathan's regime, and then it was out. I think apart from just the doctor that died and all of that. Now we're back to the issue of monkeypox, and the question will be, how prepared is Nigeria presently regarding this? We're seeing Abuja, Kano, Lagos, some of the states that have been mentioned that have to be on the lookout. And we recall we're still looking at the issue of cholera. It's not gone.
It's
We're
not
still in the
gone.
rainy season.
Yes.
And then here is monkeypox again. So this is more like a collaboration, and hence need to be put on deck. Already we've complained about how our health sector is presently. So the question will be, how prepared are we presently? Because you cannot say you can be totally careful. The way you can actually contact it is, even though it must be through contact, but you never can tell who your next neighbor is. So that is where the use of face masks, we have to bring it back again. Where we thought that, I mean, COVID is gone, so we're
Yeah.
done with that habit and washing of hands and all of that. But looking at all of these things, I think we need to bring back those old habits that we thought we're
We
done with
need to.
back again.
And so I like the fact that you took us back a little bit to the whole Ebola thing that happened that year. And as funny as it might be now, it's heartbreaking because it opens our eyes to how backward we are concerning health related information, how we do not even know basic health things to do, in the sense that believing the whole salt thing. And I remember some people die as a result of taking the salt, not even Ebola itself and all of that. So it might be funny because I won't say how my house reacted to it. We reacted to it in a very, very different way. But I won't sit down here and claim that we're not as gullible as every other Nigerian that did similar thing. But then ever since then, I think we grew a little bit regarding information. We acted differently to COVID. At least it could tell that we have outgrown the
True.
whole Ebola information, and we have improved as citizens. This is not a country, but as individuals and all of that. And now coming down to monkeypox, I believe that there are certain viruses that if we do due diligence concerning everything in this country, we can have months, years in and out without having even a single case. We can say same for cholera, we can say same for Lassa fever, we can say same for a lot of seasonal virus. I'll put it that way. Now, for Ebola, it took us out of surprise. It was new. It haven't been in existence for long and all of that. So we can say it was new. It was so the control for it. The country managed it well. That's all I can say concerning Ebola. The management of Ebola was good. We can give kudos to the government at that time because the spread compared to other West African, not until I think 2022, a country was about to be Ebola free and then new cases emerge exactly. So we did well in regard to Ebola. So far, we can give kudos to the government of the day at that time concerning coming hands on deck immediately. But when we talk about monkeypox, we know you and I have been doing this for a while. We see when it comes on the paper, it has a season, just like cholera, and it is not a new virus.
Of course.
It is not a new virus. It has been there for long. But what are the measures we put when certain periods of time, certain periods in a year is coming? We don't do anything about it. There should be a change even in the movement in and out of the country, because we always, what are the states that are often affected by these viruses are states like Lagos. We saw that for cholera. Why? Number one is densely populated. Secondly is the in and out of the country more than any part of the country. Exactly, is the in and out of Nigeria. So you never know, millions, hundreds of thousands of people moving in left, right, center. When you are approaching a certain period where certain illnesses, viruses, and diseases becomes prompt at that period of time, what are you supposed to do? You change measures at the seaport, you change measures at the airport, health related. This time around, when travelers are coming in, they need documents for certain tests and all of that. Apart from the standard, we need to, when it comes to monkeypox, is all about raising our standards when it comes to dealing with health and related situations such as this. And we can have a year move and go, years, decades moving without even having to record any case whatsoever. Why are vaccines not being rolled out? Why are we waiting till we have cases rising? Exactly. Why don't we have sensitizations, information out there concerning this? Okay, we are approaching this season of the year. This is the viruses and diseases that you are all prone to. This is what you're supposed to do. And I know Nigerians are careful. As carefree as we might look like, we take information seriously. That was why we took drinking salt seriously when it was spread across concerning Ebola. We do take health related information serious, except if it doesn't get to people. But I know that we do have a population, in as much as we look carefree, when it comes to health related issue, we do take it seriously. I can say this for sure when it comes to individuals in this country. But the problem is the gap, the accessibility, the availability of all of these things. Until we get to that point, I think certain things like monkeypox that we could live free of it in the country will keep being a problem. And looking at the fact that cholera is not gone, that's already a concern on its own. And now monkeypox, the work for this should have been months, even before now, than whatever we are going to do. But it's not too late. 39 cases. Well, I can't say it's a small number, but it can be managed and reduce it. You don't have to spread, the numbers don't have to increase, and basic information should be out there like wildfire.
Very true, because I think these are part of the things we keep saying. We don't have to wait until things are on the ground. We just like you clearly mentioned the issue of the cholera. It was until we had a number of people going where we saw that the federal government was looking forward on importing vaccines. Now we're seeing the same thing right now for the monkeypox.
Yes.
The federal government is looking towards getting about 10,000 vaccines, and I just hope I will be able to, you know, to be, shared among various federal hospitals, even though for cholera it was just in private hospitals. And I remember raising the concern, how about those who cannot access the private hospital? What then happens to them? So just like we clearly stated, I'm hoping that, just like you said, giving it to Nigerians, nobody wants to die. No one that we take information regarding our health seriously.
Yes,
so
do.
I think certain habits, just like we said, we are not health practitioners, especially when we talk about health related issues, but then we try to give the little information that can help people washing of hands. And then, I mean, according to the NCDC, in case you just notice, because mostly we see it on the skin, it just have this funny looks. I mean, just for our viewers' discretion, we couldn't put that. But then there's the way it looks, and then just in case you suspect that, you stay away from people. So it's more like leprosy or something to me, because you have to stay away until it's totally dry, the skin has peeled off, and then you have new skin. Even though most people get to recover from it, but that is if you actually detect it on time, then you attend to it and all of that. So I think this is where we really, really need to do what we need to do. Just like you said, we have certain seasons for certain illness, and therefore it's important that as individuals, as a nation, we take all of these things very, very seriously. So we hope to see the 10,000 vaccines that we would, and I hope it stopped at 89. That was how it started with cholera, before we realized more states were getting involved and all of that. So I hope it remains there, and then we shift it away from wherever it is, because I wonder how we keep having all of this. Just like you said, it's more like the smallpox, which we thought were over, and then it keeps coming in back and forth. And so we're seeing, I mean, we're still in the rainy season, and we're seeing that NEMA is advising, more like warning, the flood is becoming. We're seeing a number of states getting affected, especially, I think we saw that in Kano State, that are really, really affected by it. The number of people that have been displaced, number of people that have died during that time, and all of that. And NEMA is sending the warning. People need to relocate. People need to leave. And I think it's not just this year. They have been, we have to give it to NEMA, they have been raising awareness, trying to tell government, sending alert the fact that, you know what, the rain will be heavy between this period and this period. If you are living around the riverine areas or anything, try to do something, leave. I think we've also done that by telling people clear waterways, because the good thing about water is once you don't create a channel, it creates a channel for itself, and therefore eventually some people might get affected. But here we're seeing about 27 states are affected. So this is more than 1/3 of the nation. So I think this is an alert for everybody. If you're living by the waterline area, you need to do something, look for where it's safe and all of that. But we cannot say that this is too much information, especially when it comes to this. We keep raising the awareness, letting people know we're still in the rainy season, even though we've not seen rain for a period of time, particular state. But I mean, the weather is getting back to normal and all of that. Therefore, people need to be very, very careful and take all of this warning coming from all of these agency organizations seriously regarding flood.
So that we love getting this kind of response, warnings, alert from NEMA and every agency that is expected to help with emergency situations in the country and all of that. However, I keep having a concern. I just can't help but wonder, where are they going to relocate to? It's important to create a place for these people for a short period of time. Is one thing, Sele, to ask me to leave my house because there's going to be a tornado. It's another thing for you to give me where it's safe that the tornado will not get me. And this is the question. Is it just for them to relocate? Where else can they go safe? And then is there something that can be prepared for them? And whether we like it or not, there's little to what NEMA can do. Looking at the numbers of people that we're looking at, over 200,000 people that will be affected, over 30,000 houses, and all of that, that will 16,000 farmlands. And the loss is going to be so much. And the question is, how do the government step in? Okay, fine. Perhaps these 200,000 people can find where to relocate. But what about the damaged houses? After the rains, will the government step in to help these people get back their homes. We can leave that aside. What about our farmers? We're looking at over 16,000 farms here. And it's the time to plant and harvest. We'll soon be moving. And these farmers have farmed, and it's just going to be losses. It's either the flood giving us loss when it comes to food, or we have drought or something like that. And these are all questions that we have to raise. What is the extra mile? Because I do understand that NEMA is not, you're not just about giving alerts. You're about making sure those people are safe also. It's not just about giving the alert. It's about making sure those people are safe. And we can do something about it. Despite the number being high, on the highest side and all of that, we can do something about it. But most of the times, I won't stop saying it boils down to us just willing to do 50% than 100%. The government would rather stick to giving alerts than providing a shelter, a temporary shelter for the people that will need it. The government would rather say, we've given you an alert, rather than saying, okay, you will get your houses built after the flood and all of that. So I'm looking forward to when every agency will function at 100% capacity, that you're not only giving the alert, but you're also making sure that these people are actually safe. You go to those areas, you make sure they are safe. You're not just supposed to sit down. And you know what? We have access to the papers and television, but most of these are rural areas. So how sure are they getting these alerts as we do? Because we know, we are seeing it, but we're seeing the information, but where we are is not even the places that need people to move and all of that. So are these agencies going into those places and making sure the information get to these people, they move? Because tomorrow we might wake up hearing people are dying, and sometimes some people can be stubborn, but I don't think when it comes to safety, someone will be deliberately stubborn when they know they could have done something earlier to move into a safe position. What time did the information get to them? These are all the questions that I hope that as we are asking them, there are answers, and probably this work that we are saying needs to be done, it's ongoing at the moment.
I know, apart from the fact that one of the concerns you raised, apart from the fact that the government will meet the alert and then say, okay, certain state governors should move certain people. But then we've had cases where even when the federal government, or rather the state government, provide, mostly they are being joined together with IDPs or school, they are not well taken care of for that short period of time, just like you clearly mentioned. So since we are aware that, I mean, the climate change is nothing, it's not something anybody can control. It's globally, it's not just in Nigeria. But then what is the government putting or doing? I mean, we complained where we saw the number of delegates that went for the summit concerning climate. So people that have nothing whatsoever to do with climate were there. And we're yet to see you, what the knowledge you gathered, have you put it to effect? We've not seen it. So just like we said, it's not something that we can do, but there's something the government can do to actually make sure that people who are affected, and just like the question you raised, how about the farmlands? Who is going to pay them back? How about the homes that were being destroyed? The government going to provide them with something, a temporary shelter? Why the, so many questions are being raised regarding that. So we hope that we'll not just leave this responsibility to the government, but as individuals, also as NGOs, we should put our hands together to make sure that things work out clearly eventually. Well, I guess that's how far we can go. Thank you, Rachel.
You're welcome.
All right, thank you to our viewers and our supporters, as well as the crew, for making it out to watch Nigeria Now. We look forward again to doing this next week. Do have a wonderful weekend ahead.